When might it actually be good to avoid rotator cuff repair surgery? The only time that I think you should have rotator cuff repair surgery is if you have a complete rotator cuff tear, that's one, and you also cannot move your arm through the full range of motion, especially reaching up, that's two. And then three is that you've also given our treatment approach a solid try and it's not working out for you. If all three of those criteria are met, then surgery might help. Notice I said the phrase might help because surgery might also not help even if you have all those three criteria met. Let me break down these three criteria for you so that you can understand this just a bit better. The first criteria is having a complete tear in your rotator cuff tendon. That means that the tendon, one of the four tendons, you have four rotator cuff tendons, one of them is completely torn. Not partially torn where there's just an edge or maybe there's a hole in it, but it is completely torn all the way. It may also be detached from the bone. That's another way that they'll describe it. If you have a full detachment rather than a partial detachment, then this begins to meet this specific criteria. But if that's the only criteria that you have, and you haven't met the other two criteria yet, then I think that you still have a good chance at healing your rotator cuff tear situation and improving to where you feel fantastic. The reason for this is because you have four rotator cuff tendons, and if you lose one of them temporarily, then you have the other three to work on to compensate and take over some of the effects that that torn rotator cuff tendon can have. And then it's a race against time. If you recently had a rotator cuff tear, then what happens if it was a complete tear is you have what's called retraction, meaning where the tendon was torn, on the side where the muscle is, that muscle starts to pull the edge of the tendon away from its attachment or from where it tore. The more time goes by, the more retraction you have and the harder it is to get those edges to meet and heal so that you can regain function in that rotator cuff tendon. But even if the tendon never reattaches, let's say it's been months or years since you had your rotator cuff tear, a complete tear, and it's fully retracted. They'll even do MRIs where they can tell you this. You can still have a shot at improving your shoulder health enough to not need to have a rotator cuff tear surgery. I have seen so many people, I've helped people in the clinic here and then help people online get 100% pain relief from their rotator cuff tear and then get their function back so they can confidently do things with their shoulder without making it worse. Now, the second criteria is not being able to move your arm up all the way. Now, if you have a tear that's affecting your ability to go up all the way, then you're going to have some problems in rehabilitating. Now, separate there's pain with reaching up from you physically can't come up. Now, it's going to hurt most people to reach up overhead, but if you can continue to go up or maybe even help it with the other arm and you have the motion available to go up and it's about equal from side to side, including the side that you injured, then you have a good chance at improving your shoulder mobility. But if you have a block, if you have a restriction, maybe there's an alignment problem in the joint, or maybe you're getting the beginning stages of osteoarthritis and the joint surfaces in the ball and socket joint are no longer smooth, then you're going to potentially hit a physical restriction in being able to go up. There's also something else with the acromion, the piece of bone that overhangs the ball and socket joint, that can change shape and impede some of the motion in reaching up overhead as well. But even if this is your only criteria that's met, you still have a chance at improving your shoulder health because the acromion can bend and move. It can be reshaped. The joint can be aligned properly, which can help the congruency of the ball and socket joint and restore some motion, even if you have the beginning stages of osteoarthritis in your ball and socket joint of your shoulder. But if you have this criteria along with the other two, that you have a complete tear and it's retracted a lot, and then you haven't given our treatment approach a good solid chance, then you may need surgical intervention to see what could be done about creating that missing motion and getting your shoulder to come all the way up, and of course controlling other things like the pain. The third criteria is that you've tried our treatment approach and it's not working out for you. And giving it a good shot, if you just tried a thing or two, that's not enough. You have to really apply the treatment approach so that you can get all the effects of it, because it's a process that has many parts to get your shoulder health up enough to where the mechanics are good, the tensions are appropriate on the tendon, and you can begin the healing process and figure out how to move better in your shoulder. But here's the thing, most people, when it comes to trying natural treatment approaches for rotator cuff tears, they try a few exercises they found on the internet. Maybe they go to physical therapy and do some of the exercises there, but they're doing treatments from a physical therapist who typically specializes in helping people after surgery, and they're not specialists at helping people avoid rotator cuff surgery. And when you've tried these exercises and they didn't work out to you, and the other alternative that's been presented to you is having rotator cuff surgery, well, it's easy to say, I tried exercise, I tried therapy, didn't work, let's go have surgery. But let me give you an analogy to put things in perspective. If you're working on a bicycle, if you're trying to fix a problem on a bicycle, it takes a certain skill level. But if you're trying to fix a problem on a car, on a vehicle, on a truck, something like that, that takes another level of skill that's beyond typically what's required to know how to fix a bicycle. And then if you're working on an aircraft or a spacecraft, that takes another level of knowledge beyond what's necessary to fix a car or a truck. The shoulder is a very complex joint, and truthfully, we don't know in the medical field how to successfully, consistently rehabilitate it naturally. It's not a normal thing that gets taught to every healthcare professional out there. We're very much in the experimental phase of trying to figure out what happens, and when it comes to medications, injections, and surgery, they're truly just band-aid solutions that don't get to the root of the problem. Our treatment approach is fixing the root of the problem so that you can normalize the tensions, so that we can respect the healing time frames, and so that we can figure out how to move normally afterwards so that you can have long-term relief and not have to deal with a rotator cuff problem here again in a few years or the rest of your life, as long as you keep up strength in the right areas. So other non-surgical treatment solutions to heal a rotator cuff naturally are going to fall short unless they're taking these factors into account. If you're just doing generic exercises without knowing what phase you should be doing them in, if you're not trying to control the pain and trying to force yourself through pain to do exercises, it's only going to get worse. That's like trying to get the bicycle mechanic to work out successfully on the crew that's launching the next rocket into space. Unless they've gone through all the training, they have all the education and experience, they're probably not going to be the best person for the job. So if you've done generic exercises that you found on the internet, or maybe you're given a printout at your doctor's office that has probably the same generic exercises that you found on the internet, or you went to physical therapy and you got exercises from a professional, but they specialize in helping people after surgery and they're good at that, they're just not the best at helping you before surgery, trying to avoid surgery, then you're probably not going to get the best information needed to fix the problem naturally. So you want to make sure you get the right treatment approach, and I strongly believe that we have that for you. Now let me review those 3 criteria for you, and you have to meet all 3 in order for me to agree that surgery is a good idea for you. You have to have a complete tear in your rotator cuff tendon. You have to get an MRI or an ultrasound to tell you this, and the doctor will review that with you. Number 2 is have a restriction in your motion, not pain in your motion. You can have pain too, but you just can't get up. There's something blocking you in the way. But if you help it and you can go, that doesn't count. It just, even if you help it and you can't go, that's a problem. And then number 3 is you haven't given our treatment approach a solid chance. If you meet all 3 of those criteria, go talk to the surgeon. It might be a good idea for you to get the surgery, see what they have to say. But if you don't meet all 3, if you just meet 2 of them, then there's a chance that you can improve naturally and avoid having a rotator cuff surgery. Hey, if you want to learn more about our treatment approach, I've got a program called the Rotator Cuff Tear Recovery Program. There's a link for you to learn more about it, linked into the description below. And I've also got a bunch of free videos that we have here on YouTube on a playlist called the Rotator Cuff Tear Help Playlist. You'll find that linked in the description below as well. If this video was helpful for you, please give us a thumbs up and share this with somebody you think needs to see this. And also subscribe to our channel and hit that notification bell of ours so that you get notified each and every time we post a new video. Thanks so much for watching. I'll see you in the next video. Bye-bye.